please.
So I'm just going to talk to you about the trial that we're running now. It's called Treating Hepatitis C in Pakistan, Strategies to Avoid Resistance to Antiviral Drugs. And I'm just going to give a very brief overview of our project. So as you know, to treat hepatitis C causes chronic inflammation, which can result in liver fibrosis, cirrhosis, HCC, and death. So, of course, the World Health Organization wants to eliminate the problem, and they propose that we eliminate by 2030. For new infections, that means we need to ensure that there are less new infections compared to the rate of treatment-induced viral clearance. And so many countries, as Graham had mentioned, have embarked on test and treat programs using DAAs. However, the virological failure rates in these programs have been poorly reported. So this is really important in Pakistan because, as you all know, that the rate of your population is about 5 to 20% having HCV. So if we really want to treat the population and to ensure that we don't have drug resistance, we need to ensure that we're effectively treating, and if they're not being treated, to have retreatment. So this is the overview of our study, and it seems a little complicated, and I'm going to try and break through. So we have three aspects to our study. First is the incidence study. So we're essentially screening around 25,000 of your population and looking if they have HCV antibodies. If they are negative, that's great, and we will recall them after 12 months and see if they've been infected. And within that 12-month period, they're more likely to understand and remember what they may have done in their lifestyle that may have caused HCV. Those that are HCV positive will then get treatment with soft DAC. And then once they've finished treatment, we will look at their SVR after 12 weeks or so after the treatment. And at that stage, we also have a population who are already on treatment else from other studies or just generally, and they are able to come in and get their SVR checked. Those that have cleared the virus, they will be asked to re-come and get tested again after a year's time, just to see the incident rates of those who are being reinfected. Those who, of course, fail treatment, they will be entered into our retreatment trial, and we'll hopefully give them soft val. We also have a third arm to our study, and that's the sequencing study, and we're looking at HCC patients, and we're looking at the viral sequence analysis, and that's essentially looking for any sequences or polymorphisms that are associated with HCC or drug resistance. We then have a treatment trial, and that's essentially giving all patients who've enrolled into our study soft-vel, and that will be for 12 weeks or 24 weeks, and that's essentially looking at which treatment regime is better than the other. We'll also look at the cost effectiveness, and that hopefully will give us a better understanding of what is usable within Pakistan's regime. So far, since we started in November, we have over 10,000 patients recruited. We have over 1,000 that are HCV positive and 8,000 that are negative. We have 51 HCC patients, and we have 5,000 questionnaires completed. So that's quality of life, risk assessment, and that's really useful data that we're trying to collect and use as modelling. If you would like to keep track, because this is a very, very quick overview, if you'd like to keep track of our progress, please visit us on our website, which is Queen Mary website, or follow us on Twitter. And the more, the better. So we want people to question us and ask us if there are any better ways in which we could do things. And finally, just thanks. We've got a multi-million-pound grant from the Wellcome Trust, which Graham heads. We are working in collaboration with a team in the UK, which is Oxford University and the University of Bristol. We have amazing teams from Pakistan, including AKU, Dow University, the Pastor Trust and Asad's whole team, and of course Huma Qureshi, who's here too. And thank you very much.
Thank you very much, Naheed and Professor Graham. So now